Hello, my name is Anthony Bonagor, and I am doing my speech on Raynauds phenomenon. It is a non-life-threatening disease. It occurs when the blood vessel spasms in the fingers, toes, ears, nose, sometimes in your nipple and your tongue. What happens is, it turns a pale to blue coloration due to the spasm. But when the spasm releases, it turns this bright red coloring, which is called flushing. Flushing is where blood flows back to the non-spasmed extremity. Here's a picture of Raynauds phenomenon. You see? Symptoms of Raynauds phenomenon depend on the severity, frequency, and duration of the blood vessel spasm. Most patients with mild Raynauds phenomenon experience slight discoloration of the digits, mild numbness, and tingling around the fingers and toes. You see how white that is? It usually returns back to normal when the blood vessel spasm is released. If the blood vessel spasm is prolonged, then the nerve becomes irritated due to poor oxygen supply, which can cause severe pain and even necrosis in that affected area. The cause of Raynauds phenomenon is unknown, but they definitely know that it's due to abnormal nerve control, blood vessel diameter, and sensitivity to cold. The small arteries can have microscopic thickness in their inner lining, which can lead to narrowing of the blood vessels. There are three main ways to diagnose Raynauds phenomenon. The first way is to determine patterns on the underside of your finger, see right here. They use a specialized magnifying device to see how the blood vessels flow and if there's a spasm or thickening right there. The second way is to rule out any impingement theories, like thoracic outlet syndrome or carpal tunnel. The way they do that is by a series of range of motion tests and exercises. The third and most common way they test it is called the cold stimulation test, where doctors take a bowl of ice water. They put your hand in there for a few minutes, and then they pull it out and they measure how long it takes for your fingers and hands to go back to normal. The prevention of Raynauds phenomenon, it depends on the severity, but most commonly keep the body warm. Warm. Stay warm. That includes even going near a refrigerator or inside a freezer. Wear gloves like this lady's doing. See that? That's crazy. She does it. Also avoid first and second hand smoke, because smoking is a vasoconstrictor, which can lead to arteriosclerosis or hardening of the arteries. Also, please don't wear anything restricting like rings and wristbands and tight-fitting shoes. Ladies, that means high heels. Here's some fun facts about Raynauds phenomenon. 10% of all women in the world have it. In some cases, in the northern states, energy companies will offer you discounts because of high heating bills. Also, some cancer-treating drugs, nicotine, and propofol, which is the drug that killed Michael Jackson, can cause RP or RP-like symptoms. Research also shows that Raynauds phenomenon seems to be genetically inherited, whether it be from the narrowing of the arteries or the malfunctioning of nerves causing spasms. They've discovered that nitric oxide is another subject of research that scientists are studying in its effect of RP and its relationship. They believe that nitric oxide may open blood vessels and improve circulation by applying it locally, which means on the fingers or toes, your nose, your tongue, half to your nipple, and it releasing the spasm. Here's some other things. These are the less common ones. See the lady's tongue right there? Look how white that is in the picture. And here's a nipple. See how white the nipple is right there? Yep. Well, thank you so much. That was my speech, and I hope you guys have a wonderful day and you enjoy it.